So Dr. Halpern is a scientist and a nerd, and before I became a physician, I was a scientist, and I feel like that is very reflective in my work. I have a hypothesis, I develop a treatment plan based on that hypothesis. If it doesn't work, we're gonna shift. We're not gonna, or I'll say, hey, I'm not the best guy to treat you. You know, that's an option too. That happens, and I'm not, you know, so big that I can't say like, hey, it might not be me. And I'm gonna tell you, I'm gonna be honest with you, I'm gonna tell you, hey, I think we have this probability of this working or whatever, just because I'm a scientist and that's my background. My hobby is honestly hand surgery. I love learning about it, I love discussing it with my co-fellow. It's my favorite activity, is just solving problems and making things happen. Additionally, I'm a big crafter. That's what I like to do. I like to embroider, build furniture, make costumes, anything and everything, paint. And that's why I picked hands. I love doing stuff with my hands. So I treat pretty much trauma of the entire upper extremity. I prefer mid-humerus down, so elbow, wrist, hand, so trauma of those areas, but I do, you know, fractures all over the body. I was trained to do so. I like to do, you know, tendon work if your fingers aren't lifting up or for whatever reason, penetrating trauma. I like to do soft tissue work, nerve work. If you can't feel your fingers, you should probably come see me. So peripheral nerve compression, trauma, deformity, congenital conditions, all of those things I am very passionate about. Arthritis, all of it. And particularly, I'm kind of the first stop for a lot of, you know, autoimmune diseases because they affect joints and particularly the hands. They should choose Dr. Halpern because I'm fellowship trained in the hand and upper extremity. I know the newest techniques. For my carpal tunnel release, for instance, I do it endoscopically, so you have a much smaller incision than if you go to somebody else who wasn't trained in this technique. I'm just highly specialized in this area. So you can go to someone who, you know, they might be able to give you the same result, but they might not. And I can treat very complex conditions. This is my focus. This is all I do. So I feel like because I'm so focused in on that, I can kind of give you more options or maybe different techniques or different things I'm passionate about to try to get you the care you need. I also want to do the least invasive thing I possibly can first, and kind of what works with your lifestyle. So we're going to start at the bottom of the treatment ladder and get to where we need to go. Obviously with fractures and stuff, you can't do that. But for different, and depending on the condition, but if I can do something less invasive, I'm going to go with that. I am really into denervation right now, which is essentially, I'm not changing anything structural about your joint. I am just taking out the nerve so you can't feel it, which I think is the coolest thing ever. It's pretty much, obviously, it doesn't work for everybody. There's some times where you just have to do, as I said, everyone's different. Sometimes it's so advanced and they don't have enough motion that you can't do it. But I think it's a very cool technique. Very few people do it. It's very new. And I specifically went to my fellowship program to work with someone who does that, who can do the wrist and the thumb, which is just the coolest thing to me, that I have another less aggressive treatment on my treatment ladder. So I am an osteopathic physician, which means I was trained in a community setting. I went to residency at a community hospital. I've never, you know, big academic centers are awesome, but I've always wanted to work with the community. It's something I chose specifically. That's why I went to osteopathic medicine as opposed to an MD school. So I was trained in a community hospital. I'm passionate about community hospitals. It's where I'm most comfortable. Everyone's different. Everyone has different priorities, and you have to approach all patients differently. Some patients come in and they feel like they're a bother to you. They're like, hey, I'm so sorry you had to cancel my surgery after you did all this stuff. And I'm like, look, I don't care about doing the surgery. I care about making you better. That's what I care about. And I'm going to work with you to make that happen. And some patients come in, they're like, I honestly don't even know why I'm here. My wife made the appointment and couldn't tell you why. So look, I'm going to work with you to figure it out, and we're going to make you functional, make you better. And everyone's different. You need to communicate with your patients. It's not me treating you, it's us treating you together. You have to build a trust, you have to build a relationship, and you have to be positive. You know, if you're going in and you're not, you know, excited to be there, it's going to show. I just love when a patient comes back and they're back to doing whatever they wanted to do, you know, and they'll show you their project. Be like, hey, I couldn't do this before, but now I knitted this whole thing, and thank you for that. And it's just so cool to be able to change someone's life in that big of a way. It's, you have a problem and I'm going to find a way to fix it as best I can. I can't fix everything. So there's some stuff, you know, I just don't have a good answer for, but I'm going to be honest with you. I'm not going to tell you something that I am uncomfortable doing or I don't believe in. I'm going to do something that I think works and I think is right. And I just love when someone comes back and says, hey, I'm able to do this again. I couldn't do this for years, or I can feel my fingers. It's awesome. I can blind grab in my purse again for my cell phone. And it's just these simple things that you don't really think about, but they impact your lives in a big way. Being able to unload your dishwasher, being able to feel the plate in your hand is a big deal. So I just feel like hands are the way we experience the world, is through touch, and that's the way we communicate with people. And I just want to get people back to their passions, their hobbies, what makes them tick, and to get as much use as they can out of their hands for as long as we can.